Good afternoon. We're calling to order the August 21st, 2012 meeting of the Small Business Health Options Program Exchange Committee meeting. Welcome, everyone. Ms. DeRoos, could you please perform the roll call?
I will, thank you. So, Chair Kerr?
Here.
Right. Dr. Ford?
Here.
Ms. Clark? Dr. Coates?
Present.
Ms. Ross?
Present.
Ms. Taylor? And Mr. Wright?
I'm here.
Thank you. We have a quorum. Oh, is there?
They're back.
They're back.
All right. Do we have any announcements, Ms. DeRoos?
We don't, other than that there aren't any additional shop meetings scheduled after this one. So at the end of this meeting, there is no discussion on the next meeting, even though it says it in the minutes or in the agenda.
Perfect. All right. That does away with item number 1. Moving on to item number 2, public comment. Is there anyone in Carson City who would like to offer public comment at this point? None in Carson City. Is there anyone in Las Vegas who would like to offer public comment?
There does not appear to be.
Moving on to item number 3, approval of the minutes of the July 10th, 2012 Advisory Committee meeting. Are there any questions or concerns over the minutes that were distributed regarding the July 10th, 2012 Advisory Committee meeting? There's none in Carson City. Any in Las Vegas?
There are none.
Very good. Do we have a motion to approve the minutes?
This is Diane Ross. I move to approve the minutes.
Second from Dr. Coates.
All in favor, say aye. Aye.
Aye.
Aye.
Any against? None against? The meeting minutes of the July 10th, 2012 Advisory Committee meeting are approved. Moving on to item number 4, discussion and possible action regarding committee recommendations. Ms. DeRoos?
Item number 4 has not changed since it was previously presented to the committee and to the board. Rather, this was an effort to illustrate what the board has seen, what the board has not seen. Unless someone had a question regarding this item, I don't know that there is actually discussion regarding this item at this time.
Any questions in Carson City regarding item number 4? None in Carson. Any in Las Vegas?
There are not.
All right. Moving on to item number 5, discussion and possible action regarding the shop exchange employer purchasing model and employee choice. Ms. DeRoos?
Okay, the purpose of this report and of this meeting is to reconsider the committee's previous recommendation regarding the employer purchasing model and employee choice due to a regulation that was previously overlooked. On July 10th, 2012, the committee recommended that the board adopt the following purchasing model. The following purchasing options will be available on the shop exchange. The open metal tier, option B, and if you turn the page in your packet, it's page 305, is an illustration of those options. The open shop option, which is option D, and the package option, which is option E, and that includes the partner package, option F. A carrier may place a shop-qualified health plan, QHP, for sale in any of the above options, all of the above options, or any combination of the above options. QHPs offered as part of a package option may be offered in one or more packages. Employers will select one of the above options for his or her employees. If an employer chooses a package option, the employer will select a specific package for his or her employees. If an employer chooses an open metal tier option, the employer will select a specific metal tier for his or her employees, and the employees will be able to select a QHP from the option, tier, or package selected by the employer. Last month, when the exchange staff traveled to Bethesda for our design review, it was pointed out by the subject matter expert on the shop section that a QHP must be available in the open metal tier option. 45 CFR section 155.705B2 states that under employer choice requirements, with regard to QHPs offered through the shop must allow a qualified employer to select a level of coverage as described in sections 1302D1 of the Affordable Care Act, in which all QHPs within that level are made available to the qualified employees of the employer. So this regulation effectively changes the open metal tier option, option B, to a mandatory option instead of an optional option. So the following discussion includes the same information. The rest of this package includes the same information from the previous committee meetings. There is no new information here unless someone had a question. Otherwise, we could just go directly to the recommendations.
Any questions or concerns regarding this item in Carson City?
This is Diane Ross. What I'm hearing is that option B is mandatory. The rest of the stuff is still the option, but B is you must.
It is. It is. There is still flexibility here. There is still choice. It's just that this was brought back to the committee because it effectively changes the rating model. And so if a person wanted to have, say, the package option B, or excuse me, option E, they would also have to have that option B there, and that would change the rating model. But that part is now required. So that's why we brought that back to the committee. Does that answer your question? Okay.
What's the rating model?
So the rating model, if a plan were to, and this is my understanding, and we have people here from the Division of Insurance, I think, who could correct me if I'm wrong. My understanding is that when a plan goes to put a rate package together on how the plan will show up for the employees, what the employees will actually see, when they put those rates together, if they were only going to pick, one of these plans, the rate would be one way. Now that they have to have both, it affects how those rates are shown. It wouldn't affect it if they were only going to have that Plan B for the metal tier, but if they were to have more than one of those together now, they have to put them together, so the rates change. Did you have something to add, CJ?
I was going to say, is there anything you need to put on the record?
CJ was just pointing out that if a carrier were to choose the D, E, or F package, if someone picked those, they would pick that. They would still have to pick the B. The B is now mandatory, along with any of the other choices that they may make.
Do we have any questions in Las Vegas?
I have a question. I'm not sure what question we're being asked.
We're on item number 5, discussion and possible action, and Ms. DeRoos is describing that option B is mandatory under the regulation that was recently brought to our attention. And so in terms of this item, what we're trying to check to see if there's any clarification that you need from Ms. DeRoos. It would seem to me that we really don't have any choice but to approve this. It's something that CSIO is requiring that we approve as part of the reg. So anyway, if you have any questions on this particular item, we'd welcome them at this time.
So just, Dr. Coates, just a quick question. As we fast forward to page 5, staff recommendation, to clarify, we just need to approve that, which means that B is always going to have to be offered in conjunction with one of the other plans.
Yes, sir, that is correct. Item B would always have to be offered with or without any of the other options. So the staff
B could be by
recommendation, is to include that option B is a mandatory option, and then the other options that we previously recommended to the board stay the same.
It seems foolish to ask again, but let me just be as clear as I can. If an employer chooses D, they have to package B with it. If an employer chooses E, they have to package B with it. If an employer chooses B, they're good.
Yes. You are correct.
So I think we're done.
That would make it easy, unless there are any further questions for clarification or any comments, discussion at this time. None appearing. Do we have a motion to approve?
So moved.
If it may please,
Dr.
Madam
Ford, I
Chair.
second.
If it may please, Madam Chair, why don't we just put a specific motion? My suggestion would be to mimic what you've just said, something that if the CFR is a requirement, now it's going to be mandatory instead of permissive. But just make it clear for the record, which we are making a motion on and second and voting. Thank you.
Okay. Do we have a motion to approve staff's recommendation as written in their report?
Yes, Dr. Coates, again, I move to pass the recommendation per staff recommendation.
This is Diane Ross. I second.
All in favor?
Aye.
Aye.
Any against? None against? Let the record reflect that Ms. Taylor is present. Okay, and that concludes item number 5. Moving on to item number 6, discussion and possible action regarding dates, times, and agenda items for future meetings. It is my understanding that we have no future meetings of this particular committee.
That is correct. John Hager asked me to, again, thank all of you for committing your time. I know even just to come in today for such a short meeting took some time out of your day, and we appreciate your support very, very much at the Exchange. Thank you.
All right, concluding item number 6, moving on to item number 7, public comment. Are there any members of the public in Las Vegas who would wish to speak at this time?
There are not?
Any members of the public in Carson City? The member says no. All right, anyone on the phone who would like to offer public comment? None on the phone. Item number 6, this meeting is adjourned. Thank you all very much for your time.